On Friday, New York City Mayor Michael Bloomberg, that you see right now live, coming up to the microphone, is expected to take some questions about this. So let's listen to New York Mayor Michael Bloomberg as he addresses the concern of some people, especially in New York City and elsewhere, about the swine flu situation, what the city and the government can do about it. Here is New York Mayor Michael Bloomberg prepared to take some questions about this. We may not know until later on this afternoon if those cases are confirmed or not.
High School in Fresh Meadows. Quiero dar un poco de información sobre los casos de influenza porcina en una escuela paroquial in Fresh Meadows, Queens. And I'm here today with Dr. Tom Frieden, the Commissioner of our Health Department. Dr. Frieden, as most of you know, is a world-renowned epidemiologist and infectious disease specialist who, before joining our administration, worked around the world at controlling communicable diseases. Also with us today is Al Aviles, the President of the Health and Hospitals Corporation, Joe Bruno, the Commissioner of our Office of Emergency Management, Fire Department Assistant Chief Edward Calduff, and Emergency Medical Services Division Chief Robert Hannafay, and Schools Chancellor Joel Klein. And we also have joined by three deputy mayors: Deputy Mayor for Operations Ed Schuyler, Deputy Mayor for Health and Human Services Linda Gibbs, and Deputy Mayor for Education and Community Development Dennis Walcott. You should know that we are in touch with the Center for Disease Control, CDC, and the World Health Organization, WHO, and Homeland Security. I've just gotten a call from Janet Napolitano, and we'll talk some more with her later on. Now, I know New Yorkers are concerned, and very understandably, about the risks that they may face, and many are confused about what they should do. Entiendo que muchos neoyorquinos están preocupados por esta enfermedad y están confundidos por lo que deben hacer. What we're going to do in this case is what we do whenever there is an unusual event in our city. We'll share with you what we know and also share with you what we don't know. We're going to make decisions in real time with the information at hand, and we'll constantly reassess what we know and what we think we know as more information becomes available. Here is what we do know. At St. Francis Preparatory High School in Queens, where the majority leader of our Senate, Malcolm Smith's daughter, happens to attend, many students, fortunately not his daughter, but more than 100 students, have mild symptoms of influenza: coughs, sore throats, and fever. Let me emphasize mild symptoms. We tested samples in our public health lab yesterday and determined that they were probably swine flu. We flew the samples to the Center for Disease Control in Atlanta yesterday, where they have a newer test that's a little more sophisticated. And today we can tell you that, as we anticipated, the CDC has confirmed the diagnosis of swine flu in children whose samples we sent them. We also know that the city's public health syndromic surveillance system, which captures and analyzes 60,000 data points a day, has not shown evidence of a citywide increase in flu-like illness. Let me repeat that. It has not shown any evidence of a citywide increase. We've also spoken with all hospitals in New York City by conference call, both on Friday and yesterday, and we'll do so again today. They, too, are not reporting evidence of citywide increases, and no increase in severe lung infections such as have been seen in Mexico City. There have also been reports of sick children at a daycare center in the Tremont section of the Bronx. In that case, 5 of the 6 samples proved not to be swine flu, which is reassuring. The 6th case is less clear, and the test will be repeated today. Let me repeat that in Spanish. También hay reportes de niños enfermos en una guardería en el Bronx. Estos casos no han resultado gripe porcina.
Well, here's the top of the news while the mayor speaks in Spanish, that the 8 cases or 10 cases of the students in that school in Queens confirmed to be swine flu. So swine flu now confirmed here in New York City among those students at St. Francis Prep in Queens. It's important to note that some of those students were in Mexico just a couple of weeks ago during spring break. It is an isolated situation to that school. There are now 19 cases across the country. The mayor saying it is not citywide, an isolated situation at that school.
Have only mild illnesses, unlike in Mexico. To members of the public, if you have fever and cough or sore throat, stay home. Do not go to work or to school. Wash your hands frequently, and as always, when you cough or sneeze, cover your mouth and nose. This is how to reduce the risk of transmitting this illness. And I want to emphasize one point that may seem a little counterintuitive. If you are not very sick, please don't go to the hospital. If you have trouble breathing or feel really sick, by all means go. But if you wouldn't have gone to the hospital for the symptoms you're having before you got this information, please don't go now. Let me repeat that in Spanish. Tengo un mensaje a todos los neoyorquinos si tienen fiebre.
The mayor of New York giving some common sense advice that, we've heard it from Dr. Isidore Rosenfeld. Wash your hands a lot. If you're coughing and sneezing, cover your mouth. Dr. Rosenfeld here at Fox News suggests Tamiflu or Relenza, which could possibly help stem off a potential flu. Again, this is very isolated. Here in New York City, there have been very few cases in our country, not to the level that we've seen in Mexico City, where there have been 81 deaths and greater actions going on there than there have been here in our country. But clearly the CDC, the Centers for Disease Control, on it. In an hour we expect to have a White House briefing by the Homeland Secretary Janet Napolitano on the situation. Here back with Mayor Bloomberg, who's speaking Spanish, by the way. He's running for re-election. That could have something to do with it.
The reason for that is that all you can do is spread the disease to people in an enclosed facility. So if you're not very sick, and if you normally wouldn't have gone before you heard about swine flu, stay home, wash your hands, cover your mouth and your nose. If you really feel sick, by all means, go. Before I hand this over to Dr. Frieden, I want to address the issues of our school system. St. Francis Preparatory School canceled a student event Friday evening, and that school will be closed on Monday, and we will reassess their situation daily. For all people, students, staff, families, and other close contacts of people associated with the school, if you have mild flu symptoms, stay at home, and stay at home for at least 48 hours after your flu symptoms have gone. You'll feel better, and you'll reduce the chance of spreading the infection further. For other schools, one of the symptoms we track is illness at public elementary schools. We have not seen any clusters or increases that would suggest that so far there has been an outbreak at any other school. This could change. We are monitoring the information very closely, and as soon as we have more information, we will share it. But our intention at the moment is to have all schools open tomorrow. If there's no evidence of swine flu, influenza, where there's no reason to close the school, partially because we know the children are just going to congregate with other children, and if there is a chance of spreading it, it would happen whether the schools are open or closed. But at least in schools, we can look for the symptoms, and if we think there's children who should be tested, it will be a lot easier to identify them and to do the testing. Here's Dr. Frieden. Tom?
Again, Mayor Michael Bloomberg saying that there are now confirmed cases of swine flu here in New York City at that preparatory school in Queens, New York, where 75 kids became sick. Roughly 8 or 10 may have been confirmed, but it's an isolated case there, bringing the total in our country to 19 cases from California, Texas, and Kansas, and a lot more going on.